Hello, so I've started a timer because some of us be talking too much. Okay, so these videos I've made in the past to help me learn, memorize, and apply the things that I have taken notes on. These videos are not to get famous. You don't have to leave a like, a reply, or whatever, because I'm not trying to make money off of this. Also, my nose is a little bit stuffy. And these will be going off of Mark Klimak's teachings. As you can see here, I have a key for my green, my yellow, my red, and my pink. I have a warning about the offensive memes I add in my content, my sources, and the first lesson we're going to go over is acid-base balances. I would like to let you know, if you are watching this video in the future, that my brain, I have severe ADHD and my brain moves at 1,000 miles per minute. So if you need to slow me down and or speed me up because I started yapping about literally anything and nothing at all, please do. Feel free to do so. I don't give a shit. Anyways, starting with lesson 1, acid-base balances. You need to know acid-base balances because if you don't, you're kind of fucked for your NCLEX and your general exams. This is a semester 2 topic. So, what the fuck is an acid-base balance? The acid-base balance is referring to the acidity or the opposite of acidity, which is considered alkaline. Sometimes you will hear it as base or basic. The human body and all, oh my goodness, my nose. All living creatures have a minimum kind of acidity in the body, in their blood. For example, there is a difference between the acidity or the pH of the blood and the pH of the urine or the vaginal pH. 1 second, y'all. I gotta fucking blow my nose. I can only sort of breathe now. Okay, if I die made video, please make sure I get paid for my efforts. Okay, back to what I was saying. The blood has its normal pH, the urine has its normal pH, the vagina has its normal pH, sperm has its normal pH, and all of this is related to the amount of hydrogen ions. An ion is a positively or negatively charged, whatever the fuck you want to call it, a molecule, something, okay? It's hydrogen. The amount of hydrogen impacts how acidic or alkaline a substance is. Why is this important? Because when we become too acidic or too alkaline, everything gets fucked. So some substances that make things acidic or alkaline include carbon dioxide, which is what you need to breathe. For example, you need oxygen, we throw out carbon dioxide. You can imagine if we had a respiratory disorder, a respiratory illness, this could cause great problems because this shit goes directly into our blood and regulates everything. Another thing is HCO3 is the chemical equation for bicarbonate. Bicarbonate, also known as fucking baking soda, is a buffer. In biology and chemistry, you might have heard of it as a buffer. What it does initially, essentially in the body, is it acts as a neutralizer towards acidic substances. So whenever there is too much acidity, the body will increase the amount of I'm having a stroke. Will increase the amount of bicarbonate that is secreted from, for example, the pancreas or the GI system to lower the acidity of the body. Okay, so let's talk about the normal values. The pH should go from 7.35 to 7.45. 7.35 is on the lower end. 7.45 is on the higher end. So the lower end being acidic, the higher end being alkaline or basic. Some very acidic things to, like, in comparison would be like battery acid and vinegar or the vaginal pH. Some very alkaline things include ammonia, bleach, most cleaners for household cleaners, and sperm. CO2 or carbon dioxide, which we like to consider carbon diacid. Remember that CO2 is acidic, and too much CO2 is a problem because it will throw your body into acidosis. Now, generally speaking, when you look at your questions, the lowest pH or the acidic pH will generally be on the left side, and the highest pH or the alkaline or basic will generally be on the right side. See what I mean here with the red and the green? The green being the green being alkaline and the red being acidic. The carbon dioxide is opposite for the reason that if you have more carbon dioxide, more carbon diacid, you will be more acidic. If you have less carbon dioxide, less carbon diacid, you will be less acidic. This is the only factor that you look at, and the numbers are reversed. So CO2 is 35 to 45. 35 being less acidic, being alkaline, and 45 being more acidic, being more acidic, yeah. So because you have more carbon dioxide. Note the CO2 is the only one that is inverse, so anything greater than 45 is more acidic because there is more CO2. Anything less than 32 is alkalotic because there's less CO2. HCO3 or bicarbonate is 22 to 26. I talked about how bicarbonate is a buffer. It is secreted by the pancreas and a few other locations to maintain blood pH. The kidneys help regulate it. If the body is too acidic, the bicarbonate is reabsorbed by the kidneys. If the body is too alkaline, it will let the bicarbonate go. So, how do we look at an ABG and determine if our patient is about to fucking die? The first value you should look at, according to Mark Klimek lectures, is the pH. Again, 7.35 to 7.45. Anything less than 7.35 is acidotic and a major red flag. If the pH is greater than 7.45, the body is alkalotic and starting to look like a bottle of fucking bleach. Again, I talked about that the pathophysiology behind this is the amount of hydrogen ions in the body. We need the body to remain neutral. In acidosis, there is an excess level of hydrogen ions. Hydrogens usually move into the cell to reduce blood acidity. While hydrogen moves in, potassium will move out of the cells and into the blood. When we have acidosis, there is an excess amount of this, and we will have excess potassium in the blood. You need to associate acidosis with hyperkalemia, because when hydrogen moves into the cells, and we have too much hydrogen moving into the cells, instead of a normal amount of potassium moving out of the cells, we will have an excess amount of potassium in the blood and moving out of the cells. Associate acidosis with hyperkalemia. On the other end, alkalosis is when there is a high pH and a low amount of hydrogen in the blood. There is too little hydrogen. The hydrogen will move out of the cells and into the blood. On the opposite, potassium will move into the cells. This is associated with hypokalemia. These are inverse reactions. How do we know if an event is metabolic or respiratory? To do this, we determine where the bicarbonate or HCO3 goes, if it is in the same or opposite direction in relation to the pH. Mark Klimek teaches the rules of B's. If bicarbonate and the pH both move in the same direction, then the acid-base balance is metabolic. Otherwise, it is respiratory. That's the rule of B's. Bicarb, both is metabolic. For example, a pH of 7.3 is acidotic. An HCO3 or bicarb of 20 is metabolic. Then it sure as hell is metabolic acidosis. 7.358 is alkalotic. A HC32 is metabolic. So you know that this is metabolic alkalosis. And example 3, 7.22 is acidosis. But the HCO3 is normal. It is 35. It's on the low end, but you can't force it. So you know that this is not referring to metabolic acidosis. This is not referring to an excess amount of bicarbonate or a decreased amount of bicarbonate. If it's not dealing with an increased or decreased amount of bicarbonate, it must be dealing with an increased or decreased amount of CO2, which relates to the respiratory system. So this is an example of respiratory acidosis because we were not given the CO2, but we know the pH is acidotic. As the pH goes, so does my patient, except for the potassium, which we spoke about earlier. The potassium will either increase or decrease, increase in relation to acidosis and decrease in relation to alkalosis. So if the pH is low, everything low in the patient except for potassium. So you know damn well that patient is about to crash. They're going to have bradycardia, constipation, absent bowel sounds, flaccid limbs, obtunded, lethargy, coma, hyperreflexia, bradyapnea, low blood pressure. What is your nursing intervention? You need to monitor respiratory arrest. You're going to have that ambu bag next to you. If the patient is high pH, that person is through the roof. Everything is high except that potassium. You're going to have tachycardia, tachyapnea, hypertension, seizures, irritability, spasticity, diarrhea, borborygmi, which is the increased bowel sounds, and hyperreflexia, reflexia. Think 3+, 4+ reflexes. You need to suction because of seizures. We want you to remember Mac Kussmaul. Mac is the name of the doctor who named or discovered Kussmaul respirations. He probably didn't discover it. It was probably a woman, but he stole it from them. That's tend to be how it goes in science. So Dr. Mac, we want you to remember M for metabolic and AC for acidosis. If you see Kussmaul respirations, as in type 1 diabetes, you better think that your patient is going in metabolic acidosis. And what does that mean? They have too little bicarbonate. They have too much CO2. They have too much potassium. Everything is too high. Too much potassium, too little potassium. Everything is too high except for tachycardia. Everything is too high except for potassium. They're in tachycardia, tachyapnea, hypertension, seizure, irritability, spasticity, and whatnot. This patient is trying to blow off acidity by releasing carbon dioxide, which is that carbon diacid, to compensate for the amount of acidity they have inside the body. So they're breathing. I almost fucking choked. Really fast and really irregular to try and blow off acidity and compensate for how fucking acidic the body is. 1 second, y'all. I'm just about dead in my respiratory system. Okay, so what are some causes of acid-base balance? For the fucking time, if it is your lungs, it is respiratory. If it is fucking respiratory, now we ask ourselves, are they overventilating or underventilating? I need to use my fucking brain here, so I need you to use your brain. If they are underventilating, if they are sitting there like a fucking rock and they are not breathing enough, think anyone who just almost drowned, anyone who's sedated post-op, benzodiazepine. Remember, we are dealing with carbon dioxide. Excuse me, what? I'm offline, I don't give a fuck. If we're dealing with carbon dioxide and the patient is just sitting there like a rock, they are not blowing that carbon dioxide off By exhaling, it is just going to accumulate and retain that CO2 and make their body more acidotic. So I want you to think, instead of, ooh, are they breathing? Are they not breathing? Are they underventilating? Are they sitting there like a goddamn rock? Are they overventilating? This is for our patients who are having panic attacks, pregnant women, anyone who is in small respirations. Maybe not small respirations, but anyone who is blowing off excessive amount of carbon dioxide. So now we're going to have someone who is blowing off an excessive amount of CO2. Rather than sitting there like a goddamn rock, they're actually throwing all of their CO2 out, and it is like, all of it is going out, and if we can't keep any of it at all, if we're pushing it out faster than it can come in, we're letting the body become alkalotic because there's no carbon dioxide. Some examples in labor. This is respiratory respiratory alkalosis because we are overventilating. The pH will increase and we are in alkalosis. Drowning, that is ultraventilating, and the pH decreases, that is acidosis. If a patient is on a PCA pump, here you go, ventilation is down, that is respiratory acidosis. Remember that post-op anesthesia, sedated, respiratory acidosis. If it's not lung, it is metabolic, unless there is gastric vomiting or suction. This is an immediate sense of alkalosis. Why? Because the GI is one of the greatest secretors and sources of stomach acid. Yeah, of acid in the body. That's my fucking timer. I've been yapping for too much. If we are down on that acid, you sure as hell know we're going to be alkalotic. For everything that isn't lung and you don't know what to fucking answer, put metabolic acidosis. Set your default to metabolic acidosis and always pay attention to the modifying phrases rather than the original noun. And that is it for video 1. How do I stop this?